first phase of Governor DeSantis' plan to reopen Florida, as we know, starts on Monday. Part of that plan includes allowing hospitals to resume elective surgeries. If you had a surgery postponed because of the pandemic, so what should you do now? And as we have reported, many people are saying they are just nervous about going to hospitals. What's being done to protect you? So joining me now by Zoom is Tom Van Osdol. He's president and CEO of Ascension Florida and Gulf Coast, and Dr. Houston Gilberstadt, Chief Clinical Officer of Ascension Florida and Gulf Coast. Good morning to both of you. Thanks for joining us.
Good morning. Thanks for the opportunity.
So, Mr. Van Osdol, let me start with you. For our viewers at home who had put off an elective surgery, is there some kind of priority that you're going to give based on the type of surgery that would be able to begin first and then kind of step down from there on?
Sure. So we're going through the list of procedures and individuals and making sure that those who have the most urgent needs are able to be scheduled most promptly and kind of working through the list from there. There are a number of folks who, very understandably put off the surgeries that they needed for a period of time while we were dealing with more of the patients with COVID-19 positive. And now it's safe for them to come back, and we want them to come back and get the care that they've been delaying. It's time.
So that said, for those who are watching, what should they do? Should they call their doctor, try to reschedule? They may have concerns about safety, which I'm going to talk to the doctor about in just a second. What suggestion do you have, though, for them?
So they should have a conversation with their doctor. That's where things should begin. Our schedulers are going back through the list of procedures that were scheduled. They're contacting patients. We're in constant communication with our surgeons. But from a patient's perspective, if they want to take the volition, they should have the conversation directly with their physician.
And are you anticipating it could take weeks, even longer, considering the backlog?
Yes, ma'am. It will take us several months, honestly, to work through the queue of cases that were put on hold as we dealt with COVID-19.
And it's interesting because that brings Dr. Gilberstadt in the conversation here. Doctor, so when these appointments are being made, obviously a different protocol will be followed now, just in terms of even having people come in and having pre-op ahead of time. And you can't have all of them come and sit in the same waiting room at one time.
That's correct. As part of our safety measures, we're trying to do a lot of the screening actually virtually, so we're not bringing patients in just for the screening pieces of this. In addition, we're going to be trying to test the majority of all the patients that are beginning any procedures or surgeries in our facilities. So we're setting up testing centers in areas around the city so they can get the appropriate screening without having to come to a hospital setting.
And for those in general who are concerned about the fact that you may be treating COVID-19 patients, what kind of assurance can you give to those who are coming in for elective surgeries that there won't be some kind of spread to them from where you're keeping COVID-19 patients?
We will be that's a good question. That's one of the things I think that's going to help. And one of the things we're doing is we're going to be screening all patients that are coming in for surgeries and procedures. But in addition, we're starting to test our staff as well. So we're going to be periodically and randomly checking our staff, especially in the perioperative areas. That's going to be real important. We're going to be cohorting all the patients that are positive with COVID to separate areas. So the patients that are coming in for procedures, they won't be around any patients that are positive. So that's important that all of those patients will be in one area that's isolated away from the surgical areas. That's an important piece.
And it is, because we know that so many people have been nervous. In fact, so many have had, emergencies, maybe chest pain or a break or a fall, and they have been hesitant to go to the emergency room as a result of their concerns about the pandemic. So I'm sure what they're hearing gives them some assurance. That said, Mr. Van Osdol, what about cleaning and disinfecting at the hospital, since that is such a huge component here? How often is that done? What kind of assurance can you give to our viewers?
That's done multiple times throughout the day. We have rigorous, stringent cleaning and disinfecting protocols, and that's done multiple times every day. And so we make sure that every area is safe and disinfected, and it's an environment that's perfectly safe for patient care and for our caregivers to provide that care.
Gentlemen, thank you both for joining us. Do appreciate it. Have a great day.
Thank you as well.